Hello, my name is Kirsten Castle. I am the clinical manager of the Adult Standard PHP and the Trauma and Eating Disorder PHP at the Columbus Emily program site. And I am here today to answer the Ask Emily question. So today's question was asked by Morgan, and Morgan asks, what is the connection between trauma and eating disorders? So trauma and eating disorders are very connected. In fact, it is estimated that nearly half the people who admit to eating disorder treatment also experience symptoms compatible with PTSD. And so eating disorder behaviors can kind of serve as a way to cope with trauma symptoms. So they can numb out or reduce the experience of trauma symptoms. And there also can be like a body image component. So if I have the belief that my trauma occurred because I was a certain body size or shape, I can use eating disorder behaviors to kind of control that body size or shape. So that can feel really protective. And what we see in treatment is oftentimes when we start addressing the eating disorder and reducing eating disorder behaviors, trauma symptoms kind of skyrocket, and then vice versa. When we start addressing the trauma, eating disorder behaviors might come in. So it's kind of felt like whack-a-mole for a lot of clients of I address the eating disorder, and my trauma comes up, and then I have to go to trauma treatment, and I can kind of feel like bounced around between programs. And in the past, there was the belief in the field that you had to address the eating disorder before you could touch the trauma. But what we're finding now with new research is we can address both simultaneously, and that is yielding really positive results for people, and it's reducing that experience of whack-a-mole with symptoms. So that feels very hopeful and very exciting for the field. Thank you.